Hi, everybody. Dr. Maria Sampoulos here. Thank you for joining us on the Facebook Live event. I have Dr. Jennifer Lilery today. Hi, Jen. How are you?
Hi, Maria. I'm doing really well. Enjoying being at home today, getting some work done so you guys get to see the dining room, which doesn't get used except for this.
Yeah, of course. Why not? Once a year, right? Thanksgiving or maybe Christmas. Yeah, that's what it's for.
Totally.
I tell the kids, don't. Yeah, my kids know they're not allowed to go in the dining room. So yeah. Why not use it for Facebook Live? If I was home today, yeah, I probably should be using it too. Make it more useful, right?
That's right.
Yeah. Well, today we're having CooperVision sponsor this event on contact lenses and dry eye. There's a lot of conversation right now about dry eye, and I thought that you'd be a great doctor to interview. You have a big network. A lot of doctors follow you. Would like to get your insights on it, what you prescribe in your practice, how you deal with dry eye, and especially when patients come in and say that they can't do contacts anymore because of dry eye, because that's what other practitioners. Give us some information on you and what you do in your practice.
So I'm at a small private practice called CooperVision Eye Care. It was founded by Dr. Alicia Barnes, cold start, and about a year and a half I joined in with her as she opened up a second location. And just in the past 2 weeks, we have a third doctor that's joined us. So it's been growing really well. But the core root of our practice is contact lenses. And I always tell people, I love contact lenses. I'm not like this person who saw myself as passionate about the dry eye, but you cannot do contact lenses and not do dry eye. They go hand in hand together because you either have dry eye sufferers that really want to wear contact lenses, or you have contact lens wearers that are not happy with anything, and dry eye is the reason why. So you have to treat them both.
Yeah. So we have a patient come in from out for another office, and they say they're getting dry eye. Do you treat the dry eye disease immediately? Do you also switch them into a different contact lens? What are some of the strategies for in your practice?
I think what our patients want from us, right, is for us to say, oh, I've got a new contact lens, and that's going to fix everything. But I think that that's not necessarily your best path forward, even though when your patient comes to your chair, that's the expectation level that they have. Like, you're just going to fix it with a magical contact lens. To be a true contact lens specialist and to set them up for success with their contact lenses, you've got to make their ocular surface a friendly place for contact lenses. So the very first thing I do on my new patients is check for dry eye before we get into the contact lens part. If you see SPK on their slit lamp and you haven't even put dye in yet, that person cannot go into a new contact lens. Like, you got to clean that up fast. And so I think that for me is like step one, like, is there visible SPK? In my practice, if I see visible SPK, we're on steroids for 2 weeks, and then we'll come back and see what happens next. Let's say they're telling you they're dry in their contact lenses, but your slit lamp exam isn't really showing a whole lot. That's when you need to dig a little bit deeper. I wouldn't stop there. I'm going to put fluorescein dye, we'll do a T-BUT, we'll do a meibomian gland assessment, because if you ignore the fact that there's some underlying problems, 2 or 3 lenses in, you're going to look like an idiot. Like, oh, well, you have dry eyes. None of these contacts are going to work for you. Like, get out in front of that.
That's correct. Yeah. So contacts, once you do that, any contact can be an option, right? But even so, a lot of the new materials, silicone hydrogels, have been very helpful over the years for a lot of patients and comfort-wise. Digital eye strain and the computer has exacerbated dry eye in my practice. What about in your practice? I mean, it's an opportunity to really, help these patients.
Oh, such a huge difference. My preference on every single patient is to give them the most comfortable contact lens. And a silicone hydrogel daily disposable lens, that to me is the ultimate lens wearing experience for comfort. So if I find a patient does have underlying dry eye, that's the only thing I'm going to recommend for them. I'm not going to waste their time with lenses that I know aren't going to be as comfortable. But for every single person, even if they're not complaining about symptoms, I tell them, well, we've got multiple levels of contact lenses, right? You've got your monthly lenses here. Sometimes people say they're comfortable for the first couple of weeks, but after 2 or 3 weeks, they need to change them. Hey, maybe 2-week lenses are a solution for you. And for example, CooperVision's Avera, that's been a really great product for me on that symptomatic after a week or 2 wear. But I was like, if you want the ultimate contact lens, that's the most comfortable thing you can wear, daily disposables. And I would tell that to every single person. So if you care about comfort, that's the way we should go.
Yeah,
What about
so that's
you?
good. Yeah, so I think that a daily contact lens has been good in my practice. I fit a lot of my day, and I think that's been a great addition to my practice. And then patients would be like, "Oh, they're expensive," but I'm like, "They're your eyes. They're important. They have a great rebate. It's easier to sell a year supply. Patients are happy, right? And then a lot of the vision plans will reimburse for a contact lens benefit. So if you break it down, what they're paying per month per box, and after all these rebates and insurance benefits, it's a value. And then they also don't have that dry eye issues.
Mm-hmm. I think, and you mentioned My Day, that is such a value contact lens. It is very comfortable, but with the 180 pack pricing and the rebates, I can tell my patients very confidently, after everything's all said and done, for about $1 a day, your eyes are going to feel great. And is that worth it to you? It's such an easy path forward to put it in that kind of perspective. It's not that much of a price tag when you think about it that way, because a coffee is what, $4 a day. So what's, your eyes being comfortable all day long, or your coffee, they should have at least similar value.
Better value. Your eyes should have better value, right?
Yes.
But sometimes you get some patients that don't find value, which is frustrating at times, but because they're your eyes. But yeah, the dry eye has been, for My Day and dailies, has been a big revenue boost in my practice, and how I've kind of tackled dry eye and trying to expand my office to do more dry eye. It's an area where a lot of doctors don't really do a lot, unfortunately. When I took over this practice here that I purchased over the summer, the doctor was just giving artificial tears. So I found a big way to kind of do this, and a lot of patients were kind of out in the dark about it. They didn't know, and I kind of helped grow that part of the practice, and it's been great, and it's retention wise and keeping the patients here, right? And I think with taking care of the dry eye issue kind of keeps those patients in your office too, to purchase from you as well, right? Because they have value in the next greatest thing that comes out the next couple of years.
Oh, absolutely. You train your patients as much as your patients train and educate you. This is a collaboration. I actually use that when I talk to my patients, especially multifocal ones, where I'm like, this is like you and me getting together, and we're going to cook this wonderful recipe together. I'm going to add a little bit of mine, you're going to add a little bit of yours, and we're going to take from each other. So your patient interactions, you're going to learn from the successes and failures you have in patient care on how to mold your practice. So you're going to learn from your patients too. But definitely, dry eye is so overlooked. I think we do a big disservice when we think of, hey, you have dry eye, here's a teardrop. Because even if that teardrop is going to help, and I do use tears in my practice, I'm not saying that that's wrong, but the value that a patient now perceives, like, oh, this dry eye issue must not be a big deal because you just gave me a sample of an eye drop I can get at Walmart. So clearly not a big thing that I should be worried about. But we all know when dry eye gets into the moderate and severe stage, and that's the mindset the patient has, where it's like, well, it's not a big deal. It's going to be really hard to treat and get solutions where they can even have clear vision all during the day.
That's correct. Yeah. So I think it's a big revenue boost. And then to be incorporating contact lenses into that conversation, where patients think that they couldn't have an option before, and now it's an option. So I think that's good too. What about digital eye strain and dry eye and contact lenses? I know Biofinity has a new, it's been out for a little bit for digital eye strain energized. What is your take on it? How do you use it in your practice? How do you talk to your patients about it?
I am a big believer in digital eye strain, and that our patients are very symptomatic, but they're not going to come in and say, I have digital eye strain. Okay. What they're going to say to you is, my eyes feel heavy or tired at the end of the day. They'll complain about night driving, but their distance vision is 20/20 when you check their chart. It's like, no, your distance is fine, but they're going to come to you complaining with distance vision complaints. And really what it is by the time they get to the end of the day, their eye muscles are so exhausted, everything looks blurry.
Yeah.
My quick way of testing for this is, okay, do you guys, I think in optometry school, we're taught, oh, well, you know, for young kids, we're going to pull the near card down and do an accommodative test. For 40-year-olds, we'll start doing that near card again. But like everybody 20 to 30 doesn't get a near card somehow.
Yeah.
All of the patients need a near card. And you'll be surprised. It might be 60 to 70% of your 20 and 30-year-old patients are like, give me a little plus 50, plus 0.75. That feels better. They have these symptoms without them verbalizing it to you. Have you found that too?
Oh yeah, of course. Yeah, this digital eye strain new revolution with COVID has been huge, and every practice that I work in, corporate or private, I mean, it's been big. And when I introduced, you know, the Energize lens, and they said there's a lens out there for that, they're happy to try it. Happy to be upgraded. Patients like it. I like the fact even without contact lenses, blue light filters. Everyone's adding it to their glasses now, where 2 years ago it was like, maybe I'll hold off. Now everyone's adding it. Everybody knows. It's just educating them about the, you know, signs and symptoms and what their options are. Because a lot of the contact lens patients, even if they have dry eye, they want to stay in it. They don't want to wear. Some of them don't want to wear glasses. So you'll take your recommendations, give them the recommendations, tell them their options instead of finding it on Dr. Google or, you know, 1-800-contacts, you know, advertising to them what their best lens for their dry eyes should be.
Yeah. I want to pick your brain how you describe Energist to your patients, because I think it's a really fascinating lens, but I found that the way people present it to their patients totally makes or breaks the success of it.
Yeah. So I just say, look, there's a new lens, make it plain and simple. New lens out there for digital eye strain. We can it'll help you when you're on the computer. And it's just a regular, like your regular contact lens is how I say it. It's just more for computer use. I just make it simple. Nothing complicated.
I think you're right on track, because that's what I found. I mean, I talked to other people and like, oh, people don't like this lens. They say that it's blurry. I was like, I've never had a patient say that to me. And then when you dig deeper about what they're saying, they're presenting it as like, oh, the lens has a little bifocal in it. And if you prep a patient that their vision's going to look blurry at distance, that's going to be in their head that vision's going to look blurry. And
that's true.
So I found a lot of doctors are self-sabotaging themselves and adding this lens to their practice. I am very similar to you. I'm like, hey, you know, a traditional contact lens, you wear a -4, but you look at a computer all day long and you know what your eyes don't need to see to your arm, a full -4. So with a regular contact lens that's a -4, it's a -4, and as it curves, it's a -4.12 and a -4. You know, you get some extra power you don't need. I want to take out all that extra power that's making your eyes tired. So I'm going to give you a lens that's a -4, it's a -4, it's a -4, it's a -4. It doesn't get stronger as the lens bends. And they're like, that sounds good. So, I mean, if you want like super technical, like that's all there is to it. There's no bifocal in there.
Yeah, I feel like when we talk to patients about anything dry eye, just make it simple. Less headaches for you too, right? So, you know, if they want to get technical, you get technical. But, you know, you want to set them up for success. You want to, you know, say, you know, I think we're going to solve 99% of your problems with this option. This is specific for you. And if it doesn't, we have other options for you, and other dry eye treatments and other contact lenses. So I think it's setting them up for success.
I love how specific that lens is too. It's the only lens that's like that. So it makes it so simple. I'm sure you have patients. I have patients who will come in and they're like, well, my friend, like, I might want to try this lens, or I might want to try this. Like, can I have samples of like, you know, 3 different things? I love a lens where it's very specific. Like, you have this specific issue and this specific contact lens is exactly what you need. And there's no other lens that does that. Because our patients, like, that's just the mindset of healthcare these days. Like, everyone is a healthcare consumer. They come in with expectations of what they're wanting to get, and they're going to tell you specifically what they expect for you to give them as solutions. And I've seen that really change in the past decade of doing this profession, where more patients than ever tell me what lens they want me to give them. And then I spend a bunch of time telling them, oh, this is the reason why I don't think that's a good idea, and this is what I'd recommend.
That's correct. You're the authoritative voice. You give them what you want. And if a patient doesn't, you know, I've been up practicing 13 years now. If they don't value my recommendations, then unfortunately they should find themselves another eye doctor per se. Because, you know, if you're going to come back with a corneal ulcer you're gonna have irritation, blurry vision, dry eye, things like that, and not value what I provide service to you. I'm sure there's other patients out there that want to see me.
Right.
So I think doctors need to be a little more confident in kind of portraying that to patients and not being patients telling them how to treat and what to do. So we have a lot of things dictating what we need to do with insurances and things like that. We don't need the patient telling us, especially when we have that experience to be able to give them specific recommendations for their dry eye and contact lenses.
Yeah, no, I totally agree with you. But what I've found over the past little bit practicing in the area that I do, where a lot of people come from situations where they're kind of online shoppers, they just moved here, they're going to be here for 6 months, then they're going to leave. They're not trying to establish a relationship with you. In my area, it's kind of a transient demographic of patients. So I've found like the biggest way to get a patient to listen to your recommendation is to just listen and let them get all off their chest about what they were wanting you to do for them today. Do your whole exam in your slit lamp. And then after you've done data collection, present the specific things that you found and what you would recommend then. Because earlier on, I would want, as soon as they were, telling me this stuff, I'd be like, wait, well, this is not what I do this. And then it's just become confrontational. So instead I found, be quiet, listen, agree, do the exam, then wrap it up at the end and try to establish at least a little rapport before I give them my opinion.
How have you really grown your practice with dry eye? I mean, it is a great way to grow practice, not a lot of investment. How can doctors, because a lot of contact lenses will give them dry eye. So it is a great introduction to increase that practice revenue. What are some steps? What are the steps that you've done in your practice to grow it?
What I think is interesting is while we do talk about dry eye on our social media, we really strongly lead with the contact lens specialist marketing, because many of our patients, we know the majority of our patients have dry eye, but none of them relate to the idea of dry eye unless they're extremely symptomatic. So we lead with the stuff that the patient's interested in, which is vision correction, myopia control. I really want to wear contact lenses. And then in that initial visit, when they're coming in, we really focus on ocular surface health and prepare them for what the contact lens journey is going to be like by addressing the issues up front. Earlier in my career, I was not doing sodium fluorescein dye on every single comprehensive exam that was interested in contact lens wear, And even now it's like, do I truly have time for that on a vision plan, like reimbursement? Like, this is a debate we constantly have. But what I found is if I'm ignoring the underlying issue, because many of these patients, they're not symptomatic because they're in glasses, but they want to get into contact lenses. So they may have a tear breakup time of like 6 and no SPK, and they're trucking along just fine. But as soon as I put a contact lens on the eye, I tell my patient, like, as soon as I put a piece of plastic on your eye, the tear film splits in half. That 6 just went to 3. And guess who's feeling terrible now? So we need to prep the surface of your eye to be a better habitat for contact lenses. And then the dry eye discussion really gets, like, my patients want contact lenses, right? They want happy contact lens wear. So they're all on board with getting this dry eye. And they're the most motivated dry eye people. They will take their vitamins. They will do everything that they need to do to get their eyes happy, so that in a month we can give them contact lenses.
Yes, that's great. I think that's great to do that. Have you done collagen plugs in your practice? I think it's pretty low investment. It's great return on revenue. A great way to increase your practice as well. Have you done that in your practice?
I do. I am not the biggest person on plugs, but I do see their value. The only reason why is I found a lot of my patients have an inflammatory component, and I really have to clear that up first before I plug. And a lot of times I find as soon as I clear up the inflammatory component, they're doing pretty good without needing the plug. But there is a place for them, especially I love it on like a post LASIK or something like that, where there's not really an inflammatory core to their dry eye. But I know everyone practices differently, so it sounds like plugs are a big part of your practice.
Yeah, I've recently, because I'll have patients back, and if they're not 100% after doing, treatment, whether it's artificial tears, we do lid hygiene, we do warm compresses, I use the heating pads. That has been a big part, and to help do that. It's been a study out there now that it's coming out. They're saying that digital eye strain is causing meibomian glands to die and things like that. So they even see it in kids. So that has been a big thing. So if that's not 100%, then that's an option. And that has been something that a lot of doctors around here don't do. So it is a way to kind of differentiate myself, but also keep patients in contact lenses, but also build a practice on dry eye. I've done in the past, like advanced cases, amniotic membranes and things like that. So, those are things that patients value, right? And then they trust you. And then so you make those recommendations for contact lenses. They're going to follow your advice instead of Google, right? So. Right.
And they understand, like I feel like it's so much better before they come back for 3 contact lens checks and you've tried 3 different contact lenses. Like it's better for them to know upfront, hey, these are the issues that when we go into contact lens wear, I'm going to expect you to have. And then they're more motivated to understand, like, oh, when this lens is not performing the way I want it to, like, oh, the doctor told me that was going to happen. And that's why I need to do this XX thing that she told me about.
Yeah, I think this is all great information that a lot of doctors can take for their practice, and how, daily lenses like MyDay can help grow their practice with dry eye and keep patients in contact lenses. And there's just a lot of options out there for dry eye. And I'm pretty sure a lot of these contact lens companies are, innovating and bringing out new technology. I wouldn't be surprised within the next year or two if we have contact lenses with blue light filters or something.
Well, that would be great, right? Think about how much that would enhance your practice to give somebody something that unique and different. My patients ask me about, well, can I get blue light contact lenses all the time, because they really like their blue light glasses.
Oh, I'm sure they're coming out with it. I'm pretty sure that it takes some time to innovate and have this, but I think it'd be a game changer in general. And then also it would be an advantage to your dry eye toolbox as well. Because everything goes hand in hand. So
how do you convert patients? So like, let's say they're a happy monthly or 2-week wearer, but you really think like their life would be so much better with the daily lens. But like I said, many of my dry eye patients are like, like they're just resistant to change, even though I can see that the surface of their eye isn't loving it. So how do you get them to just try these out? And if you don't like them, that's okay. But
yeah, so daily lenses are, I can't take all the credit because the doctor at this practice, he was killing it on dailies, all right? So a lot of patients are on dailies and getting year supplies and things like that. So I did take some advice from him and learn from him. And it has been great to see patients because they're trained, right? They're trained to do this. But even so, converting the other patients over, I say, look, if cost is an issue, these are not expensive, right? After rebates, if you do the initial purchase, you have insurance. We try to get the daily contact lenses through their vision plan benefits. We try to use that. We push the year supply with the rebates. I say to them, less risk for infection, dry eye, healthy. Now everyone is, with COVID, is more health conscious. COVID as well. Just be healthy, not touching your eyes too much, right? You wear them once, throw them out. Don't have to deal with solution. And all my new wears, they go into dailies, right? There are so many different tiers of dailies out there from different companies that cost shouldn't be an issue, because for you, it's what you mark it up to be, what you want it to be. But for affordability, you can, match online pricing with 1-800 and still do pretty well. And patients have things. So you're not seeing patients for usually corneal ulcers and issues, and because it's none of that hygiene thing, right? So for me, I mean, dailies have been great in the practice, but also as an introduction to patients where, I got an option for you. You don't want to wear contacts because you love less. That's great. But you know what? I can put you in a couple boxes of dailies, like maybe 2-3 boxes, 2-4 boxes, and they'll last you for a year because you just wear them on the weekends. Activities specific. So that's been an option. And I think we're going to see a lot now coming in the summer where people want to wear sunglasses and things like that.
Well, especially this past year, a lot of my patients have gone to part-time wear since they've been working at home. And I tell them, like, if you're wearing your lenses less than 4 days a week, there's dailies will save you so much money. And so that's been a really great conversation starter to get people considering other options too. But like you said, I mean, it's safer, it's healthier, it's more comfortable. Like I want my patients to have that wow factor and to not, like if someone comes in to my office and they're wearing a monthly lens and they're talking about it gets dry at the end of the day and then a week or two, they just don't feel comfortable. I'm not going to talk about another monthly, like let's get you in a lens that's going to make a true difference to your life. And that's what I tell them. I was like, I can give you another monthly lens. It won't feel any better. I want to make a real difference for you because you told me you're having a problem. So this is the lens that will solve the issue.
Yeah, the industry's done a great job of educating patients because a lot of patients are coming into the office saying that are new, I want dailies. So, and then, at the sublease that I'm at Warby Parker, there's a lot of young people that I see, and they want daily lenses, right? So they just wear them for a day and throw them out. So the industry has done a great job of educating these patients on that technology and daily and how it's the best option. So that's been a good, easy way to kind of do that. As we train our patients, or we each other, right? Because if you have the patient that might be moving from North Carolina to Rhode Island, and I see this patient, if they're trained already, it's easier for me, right? One doctor to the other. So we all need to work together to kind of get this for a healthy option for our patients, and so we preserve, for dry eye and any other infections and things like that.
I totally agree. And I agree with you. I've noticed that there's a generational split that's happening where there's a certain age that like, oh no, monthly, like they have a hard time getting their head around the daily disposable. It's like 37 and up. But then if you've got anybody younger than that, like, oh yeah, daily, that's what I want. And so we'll see that continue to grow and change with time.
That's correct. Yeah. And parents that want to do it, right? So parents, they want the healthiest option, best option. They're concerned about their kid getting infections. This is lower risk, right? And then even when CooperVision came out with their new MySight lens, it's daily, right?
Yeah,
I mean,
so smart.
Could they come out monthly? They could have, yeah, but daily's the best option, right? I think that's the future. I wear dailies. It's easier for me. It's comfortable. And I don't have to worry about it. I mean, just one less thing to worry about at the end of the day after this busy day. You just throw them out and you go to bed. So,
right.
Yeah.
Did you ever see, so I always tell my patients, because I'm lazy, like clearly. So I just like am in bed and I take my dailies out and I just put them on my nightstand and then they're crinkly there the next morning. And then sometimes a few days and I have to like throw them away. But it always reminds me of like joking with a patient because a lot of times they're like, oh yeah, that's perfect for me. Cause like they just want to like lay in bed and then take their contact lenses out while they're about to fall asleep.
That's correct. Yeah. Yeah, you forget, right? You forget, you just take them out. So yeah, I have to say I've done that, and they get hard on the thing. So you need to make sure you have like a,
there's a little
or something there.
Perfect. Don't put it on your wood. It doesn't.
Yeah, don't put it on your wood. Yeah, that's right, because it sticks and it gets hard. But no, it's how it is now. Everyone's busy. It's just crazy. So that's another plus. So I think it's just you're interacting what the patient wants and you're getting it. And they'd be like, oh yeah, that's what, or like, just like they say, I want it for just the weekend. So when you go to the gym or when you go out to dinner or something like that, when all this gets back to normal, they're going to want that. It's an option. But now even so with fogging of glasses, patients want it. So
yes.
It's a good option. And I think with dailies, it helps with dry eye. But it's also a great way for doctors to get introduced to dry eye and build their practice with contact lenses where they wouldn't have thought of that before in the past.
Well, patients, like underlying dry eye obviously is the issue, right? But they don't want to be on an omega supplement and do the heat mask and use the drops and you know what I mean? Like, and so they do just want like, what's the most comfortable contact lens you can get me? And let me see if my eyes feel good then. And so daily, that's where we go. Like that's the simple step forward.
Yeah. And you know what? I think there's different types of contact lenses out there, right? So sometimes if they want the most affordable, so some doctors will give it to them. And then if you just present the option while they're picking out glasses or dilating, they're like, wow, I really can't feel these. You know what? It's going to make the difference. For the extra X amount of dollars a year, it doesn't really matter, right? So patients will do it if they have it. They're spending money on a lot of other things that they really don't need. Why not their eyes, right? Give them the best that they can and let them decide at the end what they can or can't afford. Don't, minimize their costs at the beginning.
Maria, you just mentioned something that I think is kind of a big key value too. So like you're transitioning someone from a monthly to a daily, like give them a contact lens that's going to be a wow factor. Don't pull out a daily lens that feels almost exactly the same as a monthly lens. That's not. And so you want them, when they get it on their eye, to be like, wow, I can barely feel these. Like, come on, let's reach for a good daily reversible lens when you're pulling the dailies out if you want to transition people over.
That's right. Impress them, right? And then, so the doctor that I was here was always high-end daily lenses, right? So I always tell them, I said, well, doc spoiled you. I said, like he gave you the best of the best. This is the best. So we're going to keep you in it, right? Your eyes are important. You're the best. This is the best that we're giving you here. We're going to continue that. So I just think it's just presenting it, right? And they're like, well, why don't I deserve the best? I should get the best, right? So just that mentality. So I just think it's just a way of communication, presenting it. I think that's 90% of a lot of things in optometry is how you present it and how you communicate with the patients, and let them know that you're the doc that they need to see and you're giving them the best options.
Well, as you and I know, the best marketing, the best way to grow your practice is happy people leaving your office and talking about what happened because you gave them an experience and a solution that no doctor has given them before. So the very best thing you can do when someone comes in is to let them leave with problem solved.
That's right. I want to thank you so much for coming on the Facebook Live today. I hope a lot of the viewers get some good information from this live event. I want to thank CooperVision for sponsoring it. And I feel like there's a great opportunity for a lot of doctors to do daily lenses and dry eye treatment. Thank you so much for joining us. Bye-bye.